Dr. Shrime, good morning. Dave Samadi here. How are you?
Good morning. How are you?
I really enjoyed reading your New York Times op-ed. I thought it was fascinating because the whole world is so much against doing any kind of surgical intervention, and everything is about waiting and watching and being passive aggressive. Your take on this? You talk about the fact that some of these surgery access can help the global business and also the economy. Please explain.
That's true. So I think the option to watch and wait things is very much a product of being in the developed world. It's the option to watch and wait is because we have the healthcare infrastructure and the systems where we can watch and wait for a lot of things. But in low and middle income countries, and I'm calling you right now from Madagascar, in low and middle income countries, often there's simply no surgical infrastructure whatsoever. So there really isn't the option to watch and wait, which means that people who have surgically treatable conditions simply just don't get them treated. They grow larger, they get worse, and these individuals are unable to actually work and be economically productive members of society.
And some of these could be cosmetic issues where it's really could cause embarrassment on the face, on the hands and legs, and it may completely, as you said, put them out of the economic force of the country, and surgery can fix it. What do we do about the cost? And one of the things that I personally have done is I've operated on many different countries. We go there, and it's not always missionary, but we try to reduce the fees to something really low as a way to help out people that may not have access to some of the high-tech stuff. Is there any plan globally to provide access to doctors and surgeons like us, and also bring patients that may be benefiting from our surgical skills?
There isn't. So there is a push from the World Health Organization, from the World Bank, from the UN for something that's called universal health access, universal health care, such that everyone should have access to health care. And part of that push is something called financial risk protection, that there should not be, as you read from the article earlier, there should not be cases of financial catastrophe that happen because you've decided to seek medical care. That's not the current state. Currently, people do face that. The president of the World Bank, Jim Kim, said in January of 2014 that one of the goals of the World Bank by 2030 is the complete elimination of financial catastrophe due to seeking medical care. So there's a broad plan in place, but how that's actually going to happen is going to have to be done country by country.